Hi guys, my name is Brenda. Today I'm here to speak about suicidal due to depression as a problem in Malaysia. In recent times, if you notice, there are many depression cases in Malaysia, especially depression due to suicides and depression due to sudden reasons. People just decide to end their life. Now, it is actually found that in recent research, there is 800,000 commit suicide cases in the whole worldwide. That is actually very scary. Now, before we go further, I would like to emphasize that there is two objectives in this topic. One is to increase awareness about suicidal actions and how we can prevent, or we as human, how we could prevent this particular issue. The second one would be to identify the possible reason for self-harm committing suicide, meaning self-harm could be hanging, cutting their wrist, taking substance and so on. So without delaying, let us go further into the topic. Okay, now that we have spoken about two main reasons this occur, let us speak about possible solutions to this issue. Now, suicide is actually an action. Everyone or every person who attempts suicide, they actually have to stop all this mental process that is going into them. They will attempt to suicide. They will have a plan. They will decide how they're going to do it, when they're going to do it, and they will actually fantasize how they, once they die, what will happen to people around them, or how would people feel around them. They might feel that people will feel pity for them. People might feel pity for this kind of people. They will fantasize this kind of feeling. So when the kind of person, or when the person goes into that kind of state, you will notice it. If you're around that kind of person, you will eventually notice it, because the person might be locking themselves in a room, or might be avoiding people, might be sitting inside some closed area. They might not communicate much, and we as a family member or as a friend who is very close to them should notice this kind of difference and quickly try to get them to consult a professional. If you think seeking help from professional is too mainstream or too direct to tell this kind of people, you can try to speak to them. You can always try to speak to them. I'll tell you how you can help on the next topic, or on the next reasons, or next solution to help this kind of people. But meanwhile, you as a human being could try to help this suicidal action thinking people. The first topic would be depression. Depression is the most common risk among suicidal cases. There is a research done among 314 patients, and it is found that the 314 patient has died or committed suicide, died due to self-harm reasons. Now, many of the self-harm reasons are due to substance abuse, early separations, meaning divorce either among themselves or their parents. This is very common issue that is spoken about today in Malaysia. Basically, you can see people having love failures and they end up having substance abuse. They take drugs, they consume alcohol excessively without even being conscious about their thought. The second most common problem in suicidal cases is eating disorder. It is found that there is 20% of the suicidal cases die due to anorexia, meaning they don't die directly due to anorexia, but they are depressed due to their condition when they're anorexic. And there are 30% bulimic patients who end up suiciding. So this, if you notice, this particular issue is very common, and it is common because of how the world, or because of how the society thinks about the particular person, meaning if they're too thin, too fat, and they comment very judgmentally. They mention, maybe they might say things in social media that might affect that particular person. The person may be posting a picture and someone goes and comments that you're too fat. These comments may not seem too severe, may not seem It may seem like a joke to yourself, but it may be very, very hurting for someone. How do they even feel hurt? Sometimes in the past, they may have many people commenting, they're fat, they're thin, they're dark, they're chubby, they're fair, or they're pale, or their lips are dark. This kind of comments, maybe in the past someone would have said it and it has. The aim of this video is to, to motivate the emotional self inside of them, to get them to have an insight, meaning a sudden realization that, oh, maybe I could do this in a better way. How come I did not think about it? This will help them to realize, might help them to realize, and we as a human who has tried to help them might make a little difference in their life. The final solution to this is, if you notice, I've been emphasizing a lot about us being conscious on our thoughts and on our people surrounding, because most of the time we could actually help this kind of people. We could help if we notice. I'm not telling you to constantly pay attention on them, but you will definitely notice the changes among your friends. Please be conscious. So we have came to the end of this session. I would like to thank you all for video, and also I would like to let you all know that we can make a difference. We could help the people around there. Please do not comment harsh words on social media, especially when people post their picture. You do not know how they feel about it. When you meet someone, do not say things that you do not intend to hear. That would also help a lot. Please don't be judgmental with people around you. Speak to them, smile at them, check out on them, and see how you could help. After all, this is the purpose why we are here on this earth, right? Thank you guys for listening, and I'll see you all soon.